So we will be dealing with the first segment. We will be dealing with reading part A. Keep smiling. Paracetamol overdose. This was asked by the aspirants. Sash had asked since he is an active member in the platform. I thought of yielding to his request, and that was not completed in the earlier session, it seems. We will not be giving details about the introduction. Almost everything about it. If there are beginners, definitely you can watch the episodes 1 to 38. And all beginners, just start watching episode 1 to 38. By then we will guide you with the 39, 40th and step by step. Okay, 4 texts, text A, text B, text C and text D, but then one theme. Text A, B, C and D. Definitely that's about one single theme. So the link connection between the text is very important for you to do it faster. 20 questions, 15 minutes, which means you have hardly 45 seconds to answer one question. Greatest challenge and enemy is time. Expeditious or fast reading task. Expected grade, always I remind you, is 450 plus, if not 500. And never ever target for 350. If you do that, psychological impact result is that you will end with 340, 330, 320 and 310, those. So OET Reading Part A, Paracetamol Overdose. I think this is the official sample number 2 from the official OET website. Thank you OET for allowing me to use this for teaching purpose. So reading Part A, if you have gone through my videos earlier sessions, you might have seen I have taught you 12 steps. But as of now, I'll be teaching you in 4 steps. But then those 4 steps include essentially all the 12 steps. But then for clarity purpose, which is useful for both beginners as well as advanced learners, we are putting into 4 steps, okay? And this should be the guideline for you for all the reading Part A practices. And if you're a beginner, I suggest you to go back to the recordings where I have repeatedly taught in more than 10 reading Part A sessions about 12 steps to be adopted for the beginners to have competency in reading Part A so that you can complete in 10 minutes, if not in 7 or 8 minutes. Okay. Step number 1, skim the 4 texts and write down a heading for each text. Text A 1 heading, text B 1 heading, text C 1 heading, text D 1 heading. That can be anything for you to understand the content. And step 2, read question statements 1 to 20. Okay, all the 1 to 20 questions. Highlight keywords and match with the related text. Means 1 to 7 you are asked to match with the text, say A, B, C or D. But when I suggest you to take second step, go through all the questions 1 to 20 and mark to which passage it belongs. Okay, just by understanding the keywords, not going into the passage now, text now. But then don't think that you are going to do all these things in your exam. No. Once you are competent, you don't require anything of these steps or anything. You can just go on answering. That's it. Step 3 is skim the 4 texts and highlight the clues. Step 2 is skimming the questions to find out the keywords or the hedging words. Step 3 is skim the 4 texts. Text A, text B, text C, text D. Taking maximum of 20 seconds for your text. Okay. Then text 4, locate the answers in the text. 1 to 20. Finished. Reading Part A, Step 1, skim the 4 texts and write down a heading for each text. Skimming for 4 text headings. First one, text headings given for text A, B, C and D. Most of the text given to you, there will be a heading for each text. There will be a common heading. For example, today the main title is Paracetamol Overdose. Then each text A, text B, text D, C and D will have separate headings. Today we have. Okay. If we don't have, if not given, read and summarize. If the headings are not given for each text, you have to read and summarize. Selection headings means section headings have to be taken note of. If there are some subheadings, main heading will not be there, but there will be classification types or something of that sort. So look at the section headings and subheadings. I'll show you exactly what are the section headings and subheadings, because today's text we have everything of this sort. Now the third option, if no text headings, section headings and subheadings are given, sometimes, very rarely, no section heading, no text heading, no subheading, just paragraph is given, if at all. What you have to do? Read the topic sentence. topic sentence, that is normally the first sentence of the text, and you will understand what is the gist of the whole text. Fourth option, if a table is given, look for table section or column headings. Look for the table section or column headings. There will be horizontal and vertical columns. There will be some headings just above the columns. Just look for those headings and subheadings, which I will be demonstrating now. Okay, section A. What is the heading? Text A. What is the heading? Paracetamol overdose is the title or the main heading. What is the text heading? Text A. Paracetamol, contraindications and interactions. Yeah, now what are the subheadings? Yeah, interaction with other medical products and other forms of interaction. Now you have all the options given here. Normally you have some headings, some heading for the text. So paracetamol overdose is a common heading title for all the 4 texts. And paracetamol contraindications and interactions is the heading for this particular text. And special warnings and precautions for use and interaction with other medical products and other forms of interaction are the subheadings. Here you have paracetamol contraindications. Contraindications means warnings, and interaction. You have interaction. So this heading is the subtotal, a summary of these subheadings. 4.4, 4.4 and 4.5 summarized into one heading, that is paracetamol contraindications and interactions. So the words are here: warnings, contraindications, interactions, 4.5. So that's how you have to understand. For this, for example, paracetamol contraindication and interactions, this heading for text A is not given. So what you have to do? You have to see the headings here, subheadings, and select the main words as the headings. Okay. Now here, what is the heading? Text heading. This is text B. Yeah. Procedure for acute single overdose. Text C, paracetamol poisoning, emergency treatment of poisoning. Just to show you for the text together, all the 4 texts. Now, all these 4 texts have their own headings. Sometimes, if at all, some people complain there are no headings. Usually authentic materials most of the time have the heading. If at all you don't have the heading, we'll show you what to be done. Now, this is the first text. Okay. Now, what you have to do if you are a beginner, make sure that you write down the whole heading first. Okay, what is the heading here? Paracetamol
contraindication and interaction.
Yeah, just take a paper. If you have a paper or notebook, just write down this heading. Then we will summarize it. We will make it shorter. So how can it be understood? Contraindications and interactions. You can understand that way. Right?
Yes, sir.
Now,
Yes,
contraindications means warnings and precautions. Okay? And the interaction with other medicinal products and other forms of interaction. Interaction of what? Interaction of paracetamol. Okay? So, contraindication and interaction is the summary of these 2 subheadings. That's why I said, if this main heading is not there, make a heading from here. Maybe you can write warnings and interactions, whatever. It's only for your convenience purpose, not for the examiner, not for any other purpose, for you to understand. So, title is paracetamol overdose. Section heading is paracetamol contraindications and interactions. Subheadings are special warnings and precautions for use and interaction with other medical products and other forms of interaction. Here, either you can take it as contraindications, or if you are a beginner, always take contraindications and interactions, because this later portion, second half, speaks about interaction. Whenever there is a keyword connected to these interactions, precautions, warnings, or interaction with other medicines, all these will be from this text A. Now, this is a text B, procedure for acute single overdose. So, what could be the heading? Procedure. So, whenever there is something speaking about step by step, something, maybe speaking about here, you can see acute single overdose. Now, hours, 4 to 8 hours, 8 to 24 hours, 24 hours, and all those things, and supportive treatment, anything of that sort appears, those questions have answers here. So, some people are asking about the tables. When there are tables, usually look at these boxes in the top and these boxes, common boxes at the bottom. They are something like subheadings. Next one, C. Here, paracetamol poisoning, emergency treatment of poisoning. So what could be the heading? Treatment, right? Paracetamol poisoning, emergency treatment of poisoning. So now treatment they are speaking. This side they have time, hours mentioned. This plasma paracetamol concentration, milligram per liter. These are very important. Okay. So this milligram and this angle. The questions will be based on those headings. Now clinical assessment. Text D is clinical assessment. What could be the heading?
Clinical assessment.
Yeah, you can make it short also. If you can understand, you can just think of a assessment. Clinically, you know, it's all about everything is clinical, right? So just for your understanding, so beginners always do this, okay? Write down, identify 4 text headings and write down on a piece of paper or notebook. Text A, paracetamol, contraindications and interactions. Text B, procedure for acute single overdose. Text C, paracetamol poisoning, emergency treatment of poisoning. Text D, clinical assessment. And try to visualize what will be there under these headings. Okay. Then what you can do for your own convenience, you can make them small, like contraindications and interactions, or just contraindications, then procedure, treatment, assessment. Those are the headings which you can look for and write down in a paper, or if you have the material hard copy, you have to write down these 4 headings. Write down on each page of your part A, text booklet and question booklet, all these 4 headings. Here, better in the beginning, you can start as contraindications and interactions, both the words you can write. So whenever there is a word connected to interactions or contraindications or warnings, you know that question has the answer here. Okay, you have headings on each page of your hard copy. If you have hard copy, you can write down. In short, however you can understand. You need not write the full word as well. If you can understand just by contraindications, if you write contra, if you understand, that's cool. Interactions, intra. If you understand, that's better. Only for your understanding. Step 2, read question statements 1 to 20 and highlight the keywords and match each question with the related text. Means you should be able to presume and say from where does it appear. These are the 4 headings: contraindications and interactions, procedure, treatment, assessment. In which text can you find information about the various symptoms of patients who have taken too much paracetamol? What are the hedging words?
Symptoms, various symptoms.
Various symptoms.
Yeah, symptoms, yes. So where it can be? Contraindications, procedure, treatment, assessment.
Clinical assessment.
Assessment, Father.
Okay. Clinical assessment, D. Okay. Till 1 to 7 you require, that is the answer ultimately. Second one, the precise levels of paracetamol in the blood which require urgent intervention. Intervention is the key word. What is
Urgent
synonym of?
intervention.
Synonym of?
Treatment.
Exactly. See how easy. So all these things can be done within fraction of seconds if you know the keywords, how to identify the keywords. Question 3, the steps to be taken when treating a paracetamol overdose patient. Steps to be taken.
Procedure.
Yeah, steps to be taken means procedure. Always in the procedure you have steps. Yeah, that is B, right? You have to tell me which letter I have to type.
B, Father.
Yes. Then 4th question, whether paracetamol overdose was intentional. Intentional. Accidental. Intentional or accident. Where do you have it?
Assessment, Father.
Assessment. Yeah. In the assessment you find out whether it was intentional or accidental. Is the person sure the overdose happened? What was the quantity, the quantum of the overdose? Okay. Number 5, the number of products containing paracetamol.
Product.
Number of products containing paracetamol.
Containing.
Where it can be? Interactions, right?
Yes,
Yeah, contraindications and interactions. It must be under interactions, I believe. Yes. What to do if there are no details available at the time of the overdose? No details available.
No details.
Where do you take their details?
Assessment.
Assessment, right? D, you ask for the details in the assessment, right? 7th one, dealing with paracetamol overdose patients who have not received adequate nutrition. Not received adequate nutrition.
Treatment.
Yeah, you'll be giving additional IV fluids or something of the treatment, right?
Treatment.
Treatment.
Yeah. C. That's it. The hedging words till 1 to 7. All you did predict correct. That's great. Now 8 to 13. 8. If paracetamol is used as a long-term painkiller, what symptom may get worse? Hedging word.
What symptom?
Long term.
So where it could be?
XTA.
Yes, Father.
Assessment.
Question 9. It may be dangerous to administer paracetamol to a patient with which viral condition? Dangerous.
Dangerous
Contraindication.
Contraindication.
Warning.
Okay.
Yeah.
Okay.
Contraindication. Warning. Yes. Question 10. What condition may develop in an overdose patient who presents with jaundice? What condition may develop? They are asking for a condition, right? They are asking for a condition. Answer will be a condition. Name of a condition. Name will be the answer. So which one?
Symptom. D, Father.
D for the
Assessment.
Okay, cool. Let's see. Anyhow, 11th one. What condition may develop on the third day after an overdose? Third day.
What condition?
Okay, what condition? They are asking for a condition again, right? Name of a condition.
It also D, Father. This
D. It's D.
So, what drug can be administered orally within 10 to 12 hours as an alternative to
Still sustain.
Acetyl
Sustain.
where is it to? After 10 to 12 hours.
C. Treatment. Treatment.
13. What treatment can be used if a single overdose has occurred less than an hour ago? What treatment?
C. Treatment.
So, okay, and less than an hour ago. An hour ago. So that's also a keyword for you to identify the answer.
Single
overdose.
14th one, right? If a patient has taken metoclopramide alongside paracetamol, this may affect the dash of the paracetamol.
Interaction.
Yeah, alongside, which means yeah, interaction. Question 15. After 24 hours, an overdose patient may present with pain in the dash. Pain in the dash means some body parts, right?
Assessment.
D, Father. D, assessment.
16th one. For the first 24 hours after overdosing, patients may only have such symptoms as, they are asking for a symptom, right? Answer will be a symptom.
Father. D.
D.
17th one. Acetylcysteine, yeah, should be administered to patients with a paracetamol level above the high risk treatment line who are taking any type of dash medication.
C for
Treatment.
treatment. C.
Some medication, they are speaking about some medicine, right? Then 18, a non-high risk patient should be treated for paracetamol poisoning if their paracetamol level is above dash milligrams per liter 8 hours after overdosing.
Diagram. In C.
C, Father.
Non-high risk.
Non-high risk and
Yeah. Then you have hours. If you have seen there, hours was there in C, right? A high risk patient who overdosed dash hours.
C.
also in C.
So, there should be a number as the answer, right? That's why I said you should be looking at the word before and after the space given, dash given. Should be given explicitly if their paracetamol level is 25 mg per liter or higher. 25 numbers are important.
C.
C.
C further.
Okay, C. 20. If a patient does not require further acetylcysteine, they should be given treatment categorized as dash only.
B.
B, Father.
B further.
Yes, B is correct procedure. Right. Step 3. That is the step 2. Okay. Question. You identify the hedging words, keywords in the question, and match with the text. Maybe 1 or 2 will be wrong. It's cool. When you go locate the answers, it will be cool. Okay. Step 3. Skim the 4 texts and highlight the clues. Now you'll be skimming the text. However, if you want to skim the text earlier with the headings, when you find the headings there itself, you can do it. If you're competent enough, you can just skim together and highlight the keys as well. Skim 4 means highlight. Names. Already we have done with the headings, subheadings, and title. So other things, names or abbreviations of condition, medication, organ, test, symptom, device, all these names. Numbers or percentage, symptoms, time or
symptoms,
duration expressions, sequential expressions, frequency expressions, scale, adjectives, conjunctions, negative expressions. Yeah, even modal verbs and all you can do, but then at this juncture you don't require. No, you don't require. If it are some challenges, you can do it later. This will be cool. Now these are you'll have to identify these things here. Headings, subheadings we have already seen, so we need not worry about them.
Long term, Father. 3 months.
Long time,
more than
Long
3
time.
months.
3 months.
Yeah,
2 days or more.
Headache,
2 days or more.
Headache.
2 days or more.
headache is symptom, right? Then
Alcohol dependency, Father.
yeah,
Renal or severe
Yeah.
hepatic impairment.
see all these will be important, and one of the answers will be somewhere there. Shock,
Hepatitis
electric
C,
inflammation, or
Father.
liver, or due to
Hepatitis C virus.
hepatitis B. See, due to cause and effect language is always important. Okay, that
Liver
signals
disease.
due to
Non-cirrhotic alcohol
Shock
liver
and-
disease.
yeah.
cirrhotic
Next,
cardiac liver disease.
non-cirrhotic alcoholic.
Alcohol disease.
Yes, under interactions.
Anticoagulants.
Yeah, you
Anticoagulants.
have
Domperidone.
names of medicines, right?
Yes,
Yes,
Father.
Metoclopramide.
Metoclopramide.
Meperidone.
Yeah, yes, you can underline and go as you glance through. It requires a couple of
There are
seconds.
numbers.
Numbers
169.
Total of 169.
118.
Yeah, all these numbers can be highlighted. One of them could be the answer. And here you have some expressions like
Increase.
scale expressions, increase. Just having a glance at it will help you if there is something connected to that. Because increase and reduce are there, opposites are there. Right. So that is what we highlight the clues. Okay, skimming for clues. These are the things. Normally you have answer from these things. Let's see. We have a title here, section heading, subheadings. Then you have name, abbreviation, condition, test names, hepatitis C virus, non-cirrhotic alcoholic liver disease, all names of conditions. Then you have names of medicines. Then you have number. Now you see time expression log term 3 months. Then you have abbreviation MOH. And you have scale if you want. Then you have symptom, headache. Okay, name of your disease, hepatitis C virus, and non-cirrhotic alcoholic liver disease. Then you have names of medicines here, 3, 4 of them. Then you have scale expressions, numbers. This we have already seen. Yeah. Now, procedure for acute single overdose. What do we have to highlight here? I'll not be able to highlight because this is a table. What do you think is important here?
Hours, Father. Hours.
Acute single dose.
Yeah, hours, acute single
4
dose.
hours.
Less than 4 hours.
See, these are the most important things. Acute single overdose, establish time since ingestion. Time, dose, then hours. Okay. Somebody was asking me how to identify find out the answers in the table. So these are the headings or subheadings of the table. Single dose, time, then hours.
Time.
Okay. Then at the end, after 4 hours, below 4 hours, 4 to 8 hours, 8 to 24 hours, 24 hours, or unable to establish, means not able to establish what time has passed after overdose. So they might ask 8 to 24, they might ask 10 hours. Then, it should be here, right? Then below this, including all these, again, you have given some important headings like patient need treatment with
Acetate system.
So here you see no and S.
No.
No means no need of this medication. Yes means yes, need medication. So the questions will be based on these no, yes, and hours, single dose, and the time of ingestion. See the time expression. Okay. Then you have hours. Then you have name of the medication. Now, paracetamol poisoning, emergency treatment of poisoning. What are important here? In the table here, below you have hours, right? And vertically you have milligram per liter plasma paracetamol concentration. So hours and milligram per liter is important measurements. Okay, what else you have?
Normal treatment line, then high risk treatment line.
Okay,
Nine
normal,
for
high
the
risk,
graph.
yeah, that's important. Then here in the text,
Time out.
Name further.
text,
Name hours within 0 to 12 hours.
okay, 0 to 12 hours.
Vomiting symptom. Medicine.
Cannot be used. Negative
Methionine.
expression.
Methionine, Father.
10 to 12 hours, right?
Yes.
What else? Vomiting, you said. Enzyme inducing
Medicine.
drugs, medicine, right?
Yes.
Yes,
And
Father.
whatever is inside the thing, you can just glance through, but may not be that important, okay? That's how you save time. That is a secondary information. If at all when you enzyme inducing drugs, when they are asking about that, you can come and look into this paragraph, what is inside the paragraph. Or is always important, okay? Conjunctions. You remember I told you wherever or and conjunctions fanboys come,
Yes, Father.
they are important. Just check whether this is important when you find the answers, okay? Who are malnourished or after, or you have malnourished. Whatever comes before or after or will be important after conjunction and before conjunction. Then there is medicine, right? Name of a medicine
Acetyl cysteine.
above the high risk treatment line. Okay, that is cool. So this is how it goes. See, numbers milligram in liters, numbers hours this side, this angle, horizontal is hours, this is milligram per liter. Whenever there is a question about milligram per liter or hours, everything will be here. Then you have names of the medicines here. Then you have number here. Then you have or here. Then you have scale expressions above the high risk. High risk is the scale expression. Cool. Shall we go to the next? Clinical assessment. Tell me what are the things to be highlighted.
First 24 hours. Vomiting, nausea,
And
and conjunction.
Hepatic necrosis.
hepatic necrosis.
The system is teaching me patience.
After 24 hours.
Of nausea and vomiting, right? This one is
Hepatic
right.
necrosis.
Jaundice.
Then
Necrosis. Right upper quadrant.
Right
Jaundice.
upper.
Jaundice.
elevated transmissions and right
Jaundice.
quadrant pain, jaundice, all those things are names, right? And there are many names, one will be important.
Liver failure.
Encephalopathy,
Then-
alburia,
Day 3 number. Right hand
That is-
side bullet point. Renal failure usually occurs around day 3.
encephalopathy, alburia, hypoglycemia.
Okay, these are names, right? Okay,
Condition.
conditions. Okay, history,
Suicide risk.
Time of overdose.
alcohol, anything else?
Enzymes.
Liver enzymes.
So that is which step? Done with? Which step?
3 further.
Step 3, right? So symptom is there, name of the disease, abbreviations, all those things. Cool. Next step. What is next step?
Locate the answer.
Locate the answers in the text.
Look at the answers in the
Question
text.
1 to 20. Now, first one, the various symptoms of patients who have taken too much paracetamol. You said it is in D, right?
Yeah.
Where is it? The various symptoms of patients who have taken too much paracetamol. Commonly, patients who have taken a paracetamol overdose are symptomatic for the first 24 hours or just have nausea vomiting. So the text is here, right? That's just to match the text. So information is in this text. Question number 2. The precise levels of paracetamol in the blood which require urgent intervention. You said is C, treatment, right?
Yes,
Yeah,
further.
test C. The precise levels of paracetamol in the blood which require urgent intervention. Where do you have it?
Emergency.
Emergency
Emergency
treatment.
treatment.
Emergency.
Emergency treatment. Yeah, heading itself tells you. And question number 3, the steps to be taken when treating a paracetamol overdose patient. When you said steps, it is in procedure, you said. Text B. So to be taken when treating a paracetamol overdose patient. These are the steps, right? Fourth one, whether paracetamol overdose was intentional. You said D, assessment.
Yeah.
Intentional.
Suicidal.
Suicide.
Suicidal risk.
Yeah, suicide risk was a note left. Okay. This is from the history. This is just to match the text. Then fifth one, the number of products containing paracetamol. You said it is in the text A, contraindications. Yeah, a total of 118 brand names are known to have paracetamol in their formulation. The number of products containing paracetamol. We have already highlighted that 118 number, right? Yeah. Question 6, what to do if there are no details available about the time of the overdose? You said it is in procedure, right? Text B. 24 hours or unable to establish the time. There are no details available about the time of the overdose, which means or unable to establish. You know, there is a conjunction here, right? Or 24 hours or unable to establish. So whatever comes before or after or could be the answer. Then seventh one, dealing with paracetamol overdose patients who have not received adequate nutrition. You said C. Yeah, or we have a conjunction there who are malnourished. Yes, it is here. Eight, if paracetamol is used as a long-term painkiller, what symptom may get worse? A, you said contraindications. If are used as a long-term painkiller, what symptom may get worse?
Headache.
Analgesics are used long-term. Long-term is here, long-term is here. Okay, analgesics, painkiller, right? With administration every 2 days or more frequently, or there is again a conjunction. After that, there is an answer, right? Headache. Headache is the answer. See how the paraphrasing is used here. If paracetamol is used as a long-term painkiller, what symptoms may get worse? Analgesics, painkiller, long-term, symptom, headache, and may get worse, may develop or increase. See, painkiller, analgesics may get worse, may develop or increase. So those are the synonyms and synonymous expressions, and this is known as paraphrasing. Ninth one, it may be dangerous to administer paracetamol to a patient with which viral condition? You said A again. Hepatitis C. I said due to, when there is a cause and effect language used, usually there is a chance of a answer. Next one, what condition may develop in an overdose patient who presents with jaundice? You said it is in D. What condition may develop in an overdose patient who presents with jaundice and can progress to acute liver failure, right? Progress to is the language used. Cause and effect language used. Clear?
Yes.
11th one, what condition? Again, they are asking a condition. You have to find a condition, name of a condition. What condition? 10th also was a condition, right? What condition may develop on the third day after an overdose?
Third day.
What condition on the third day after an overdose?
Renal failure.
Usually occurs around day 3. Day 3, third day.
Yeah.
Renal failure.
Renal failure usually occurs around day 3. 12th one, what drug? So they are asking for a name of a drug, right? Earlier it was 10th and 11th was name of a condition. Now it is what drug can be administered orally within 10 to 12 hours as an alternative to this medicine. You'll have to read it. Okay, 10 to 12 hours. We have seen, we have highlighted. Some name also we have highlighted. So what drug can be administered orally within 10 to 12 hours as an alternative to this medicine? See, with methionine by mouth. Interval has taken within 10 to 12 hours. 10 to 12 hours. So when there is a number, there is an answer. Clear?
Yes.
13th one, what treatment? They are asking for a name of a treatment. Can be used if a single overdose has occurred less than an hour ago. Less than an hour ago. Less than 1 hour means less than within below this, right? 4 hours. Less than 1 hour. You see that number, that the duration. Since ingestion.
Activated charcoal.
Consider activated charcoal. Consider the treatment activated charcoal. 14th one. If a patient has taken metoclopramide alongside paracetamol, alongside with interactions, this may affect the dash of the paracetamol interaction. If a patient has taken alongside paracetamol, this may affect the speed of absorption of the paracetamol. Speed of absorption of the paracetamol. Yes. Next one is 15th. After 24 hours, an overdose patient may present with pain in the dash. Where do we have the pain? A location. After 24 hours, an overdose patient may present with pain in the right upper quadrant. Yeah. Yes. After 24 hours is the indication. After 24 hours. How easily you can come and just locate that 24 hours. Then 16th one. For the first 24 hours, after overdosing, patients may only have such symptoms as dash. They are asking for a symptom. Name of a symptom.
Pain. Right upper quadrant.
Commonly, patients who have taken a paracetamol overdose are asymptomatic for the first 24 hours or just have nausea and vomiting? So the answer is nausea and vomiting. We have already highlighted. Yeah, symptom we had already highlighted. 17th one. This medicine should be administered to patients with a paracetamol level above the high risk treatment line who are taking any type of dash medication. Again, one medication, type of medication. Type of enzyme inducing medication. Patients on inducing drugs. Medication synonymous drugs. Is that clear?
Yes.
Yes.
Yes, Father.
And 18th one, a non-high-risk patient should be treated for paracetamol poisoning if their paracetamol level is above dash mg per liter 8 hours after overdosing. 8 hours is important, mg per liter. One number they are asking for, right? And somebody was asking how to identify these things. See, the numbers are here below, right? Hours. Hours are here. How many hours they are asking?
Yes,
8 hours.
8
8 hours is
hours.
here. And then they are asking, this joins here, right? And it should be 100. 8 hours when you take down, when this line, no? Treatment line collides here, right? This line. Normal treatment line. So that is the point. So
Non-high
it
risk, yeah.
comes with 100. If you go high, it will go below this side. So that is it, how you find easily. So the answer is 100. 19th one, again, high risk patient who overdosed dash hours ago. They're asking for an hour number. Okay, duration. Should be given isomethylene if their paracetamol level is 25 mg liter or higher. So you have to look for a 25 milligram per liter or higher. Okay, high risk patient. And you have to see the hours. You have to find out the hours. Earlier it was mg per liter you have to find out. Now the other thing you have to find out. Which hours you have to find out. 12 hours, right?
12.
Yes.
Yeah. So you have to look at 25 mg per liter on the vertical line of high risk patient. So which is the vertical line? This one. You have to identify 25. Where is 25? It should be between 20 and 30, right? 20 and 30. Okay. So this is 25. Now you have to see where this line collides.
High risk
25
line.
or higher. Okay. You have to find out the hours. How many hours now, Diya?
12 hours.
12 hours.
Yeah. 12 hours. So answer is
12.
12 hours. Earlier they are asking mg per liter, 100 was the answer. Here they are asking for the hour. When hour is asked, mg per liter is given. When the mg per liter is asked, hour is given. They said 25 or higher. Even if little goes high or low, no problem because they are asking higher, right?
Yes.
Yeah, but then you cannot go to 40 in here. That will not connect with this line, right? Or you cannot come to 10. It won't connect here. 25 will not connect with the 10. See, if you take 10, 10 goes this way.
40.
The line will not collide, no? This line?
No,
This
Father.
line has to collide, yeah. Did you understand that?
Yes.
Yes,
There are
Father.
repeated
Like
questions
graph.
on this, how to find out this. One of these will be given, other one you have to find out. Just draw the line, that's all. Yes, 20th. If a patient does not require further, they should be given treatment categorized as dash only. Procedure, you said.
Supportive treatment.
Yeah.
It
If
is
a patient does not require further this medicine, patient needs treatment with the doesn't require. So supportive treatment. No, I said no, yes or no. Based on that, there will be one answer. So supportive treatment only. Name of the medicine. Yes or no. Supportive treatment only. Is that clear?
Yes, Father.
Can you explain again?
Last one for the 20th.
20th. If a patient does not require further acetylcysteine, they should be given treatment categorized as dash only. Which category of treatment must be given when patient does not require this particular treatment? Patient needs treatment with acetylcysteine. So no or yes, I said, these are important. When you need, when you don't need, when you
Need or not?
need and no need. See, patient need treatment. No need. Yes, need. The question is asking if a patient does not require, which means don't need. No need. They should be treated with what?
Supportive treatment.
Supportive treatment.
Only
And
also is there.
only is
Father.
also a clue. Yeah. That's why I said always consider the words before and after the gap. That will also help you. Is that clear?
Yeah, Father.
Yes.
Thank you.
Maybe this is the most challenging among the 5 samples given. Others are very easy, but then this gradually as you practice, this will be cool. Diagram, if you don't understand, let me know, okay? That is simple. Once you get the clue, diagrams are simple. But another thing I tell you, these days you may not have diagrams given in your exams. And the students report there was no diagram, only 4 texts. Consistently, they are reporting that way when they write the exams when I ask them.